Good evening. I'm Karen Kaplan, and it's Tuesday, December 7th. Here's the latest on what's happening with the coronavirus in California and beyond. Sydney Breda Nixon is a 17-year-old senior at King/Drew Magnet High School of Medicine and Science in the Willowbrook area of South Los Angeles. The school is full of high achievers, and its next-door neighbor is a regional medical center and medical school, but that wasn't enough to insulate her from the effects of the pandemic, especially its effect on her mental health. The global health emergency made everything feel dull and hopeless, she told my colleague Howard Bloom. She lost interest in the activities she used to enjoy. Even the prospect of spending time with friends and family held little appeal, until her sister helped pull her out of it. Sydney is hardly the only student at her school to confront mental health challenges made worse by the pandemic. Nor is her school an outlier in that regard. Multiply her campus by the 130,000 or so schools across the country and you've got the makings of a crisis. If that sounds like some overwrought teenage angst, consider that 1 out of 4 children experienced depressive symptoms, and 1 in 5 suffered from anxiety, at some point during the pandemic. The incidences of both depression and anxiety have doubled since the coronavirus burst onto the scene. Need more evidence? How about this? The number of adolescent girls who wound up in hospital emergency rooms after attempting suicide was 51% higher in early 2021 than it had been in early 2019. It was also 4% higher for adolescent boys. It's enough of a crisis that U.S. Surgeon General Vivek Murthy issued a public health advisory on the mental health challenges confronting America's youth. And it's been exacerbated by the hardships thrust upon kids by the pandemic. It would be a tragedy if we beat back one public health crisis only to allow another to grow in its place, Murthy wrote in a preface to the advisory, which was released Tuesday. Indeed, it has often seemed as if there is a direct trade-off between protecting public health and protecting mental health. Distance learning kept the coronavirus from spreading, but it also cut children off from their friends, teachers, school counselors and others. This isolation made it harder to recognize signs of child abuse, mental health concerns, and other challenges, according to the advisory. Children from all backgrounds have been affected,